just for when you guys are going to talk, because I think that everybody should probably be muted upon entry. Can everybody hear me? Heather, you can hear me? Okay, good. All right, so I'm sure not everybody is on, but I'm going to start with just an introduction of who's going to be presenting with me tonight. And then I'm going to pass it to Ashley, if Ashley's on, so she can go over an update on some hospital policies, and then we'll just run through our agenda, and hopefully we'll get through everything and be able to answer all your questions for today. So introductions, I'm Jenn Barry, and with us tonight, we also have Ashley Kjarbo. She's on the board of Birth and Beyond Resources. Also Lisa Garcia, she's also on the board of directors and also a nurse. So thank you, Lisa, for all that you do for us. We have Felicia Acevedo. She is on here as Rosanna. She is just an amazing person, and she's with us. I have 4 kids, just in case you didn't know. One of them is bound to interrupt me and throw me way off, so I apologize in advance. Here's one of them right now. His name is Roro. He's got an iPad, so I don't understand why can you go ask Daddy? Daddy. Thank you. We also have Christina Harris. She's with us tonight. She's one of our Birth and Beyond educators and doulas. And Susanna B Gatz, she's with LIDA. She's here with us tonight. She's going to go through some different positions you can use during labor. We have Heather Simonsen. Is it Simonsen or Simonsen? You can't tell me because you're muted. Simonsen, that's what it sounded like. Okay, Heather's with us tonight. She is the owner and starter of the Sea Change Wellness Center, and she's got a ton of things on her title list that I don't know all off the top of my head, but she's going to help us tonight with some breathing techniques. And we have Laura Siddons is from LIDA. She's going to be joining us later on in the call to go over some really exciting things we're working on. And I'm sure we have some others on the call that are just here for support. I know Dr. LaPerry is going to join us for a little bit just to see what she can do to support us. So that is everyone I have for right now. Ashley, do we have you on the call? Let me see. There she is.
Yeah, I'm here.
Yay!
All right, cool. You ready?
Whenever you are.
Go ahead.
All right, guys. So we have a lot of people that has helped around making some phone calls, finding out what hospitals are doing, what's going on with everything. So as of yesterday, 3:25 updates. Good Samaritan we have been told they are not allowing moms to have any partner with them in labor, delivery, or in postpartum. So unfortunately, Good Sam is not allowing any support personnel at this time. Beginning March 23rd at noon, Mount Sinai, South Nassau will not be allowing moms to have any partner with them, the same labor, delivery, or postpartum. So unfortunately, there's another one that's no longer allowing any support personnel. Mercy Medical is allowing 1 support person, which can be anybody. It doesn't have to be just the dad. However, this person must leave after birth, and they are checking the partner's temperature upon admission. So at this hospital, they are not allowing any support personnel to remain with you in the postpartum care. Over at St. Catherine's Hospital, they are allowing 1 support person. There's no switches. You cannot go in and out. Once you're in, you're in. The same person can stay in the postpartum as well, so you're not being kicked out after birth over at St. Catherine's. Over at Winthrop, it is allowing 1 support person. Same thing applies. There's no switchings. You can't come in and out. It's not come as you please. Over at LIJ New Hyde Park, it is allowing 1 support person. Again, there's no switching. You can't come and go. That same person can stay with you through postpartum care. At North Shore Manhasset, it is allowing 1 support person. Same thing. There's no switching, no ins and outs. That same person can also stay with you in postpartum care. Southside is allowing 1 support person in labor and delivery. There's no switches. You can't come and go. However, that person must leave after delivery. They cannot stay with you in postpartum care. Huntington Hospital is allowing one support person. There's no switching. There's no in and out. That person must leave after delivery and cannot stay with postpartum care. Peconic Bay Hospital is also allowing one support person. No switches, no in and out. That person must also leave after delivery and cannot stay in postpartum care. We have a hotline for Northwell Health's COVID-19 obstetrics hotline at 1-833-487-2273. Currently, Stony Brook Hospital is allowing one support person. They are able to stay in the postpartum care unit as well, but again, no switches, no ins, no outs. And St. Charles is also allowing one support person, no switches, no ins and out, and they can stay with you through the postpartum care. I will also say that my cousin's wife literally just gave birth today, approximately 4 hours ago, over at Northwell Huntington, and he is with her in postpartum care, and he's not obviously leaving and is gonna be there until they're both released. So that's our rundown of our hospital updates from March 25th. That were all phone calls that were made. We're going to put this information up in the Birth and Beyond Long Island group, so it's all in a read format so everybody could see it, as well as the phone number for Northwell's obstetrics hotline. And that's what we've got on here. I believe Katz Hospital Northwell at this point also indicated there was one person that was allowed to say. I think that covers all of our list.
Thanks, Ashley. Yeah, that's good. And I just wanted to piggyback because I spoke to Chris Coaches, who's the head of Stony Brook Midwives. I know we have a lot of people on the call that are birthing at Stony Brook. She, obviously she can't like guarantee that it's going to stay that way, but she said that it most likely will stay that way, that you will still continue to have your partner there. And that's probably not going to change. However, when we're running this call tonight, we are going to try to gear it towards you not having your partner there, just to prepare for it. In that worst case scenario that the partner can't be there. And I know some of you are birthing at some hospitals like Mount Sinai and Good Sam that aren't allowing partners. And just a side note on those Catholic hospitals, we have a very strong feeling that they will follow suit with no partners or no support person allowed. So that includes hospitals like St. Catherine's and St. Charles, and strong feeling also on South Side going to no support people. So we're going to try to run this call as if you're not going to have your partner. If you do, wonderful. It opens up some options, but if you don't, we're going to chock full you of things you can use for your birth. Thanks, Ashley. I appreciate that. We're also going to try to update it for you daily so that you're not stressing out and having to call around and get this information for yourself. So we'll broadcast it daily on the updates if anything changes. And Southampton, Danielle, is going to be the same as Stony Brook. They're both the same, owned by the same leadership. So they're going to follow Stony Brook's on the partners. So Southampton's looking pretty good also. Okay, so I'm going to pass it over to Lisa Garcia to talk about COVID and your pregnancy, and COVID, your birth, and COVID and your breastfeeding.
Okay, there I am.
Hi,
everybody. Hello. Don't mind the screaming child in the background. So I'm going to discuss COVID. I'm going to quickly just talk about like risk to the fetus. Also just some like, I guess, facts about COVID that it's actually changed since I looked this up yesterday versus today. And then we'll talk about COVID and breastfeeding, and COVID if you're positive or under investigation, what it means if you're birthing in the hospital or you're, under suspicion of having it. So the first thing I want to talk about is the risk of COVID and the transfer to the fetus for the pregnant person. They still don't know really if COVID can be passed to the fetus during pregnancy. but to date, the virus has not been found in any samples of amniotic fluid or breast milk. Placenta testing is underway. There's this doctor, and I can't remember her name, it's out of my head, but she did all the studies when West Nile was going around, and she studied placentas, and she did like the serology, which is like immunology in all the pregnant patients. So she's actually doing that right now for COVID, which is very promising, and so thankful for that. But pretty much with the placenta testing, there's really no information yet because it's so new. But with the serology, they're going to be testing pregnant women before exposure, so when they're pregnant and healthy, and then after if they do come up positive for COVID. So the other cool thing I found was, sorry, I have a lot of papers here, with the breast milk. So they have not found COVID in breast milk, but what they have found, and this is new since yesterday, is there's actually we're not going to be surprised, but there's antibodies against COVID detected in at least one sample so far. So that's really amazing and really super important when it comes to, you know, COVID and breastfeeding. So that's kind of the next segment I'm going to talk about. Obviously, you know, if women plan to breastfeed and there's concern with COVID and being separated from the baby, it's really their choice. So I'll go over what the CDC and the WHO is recommending in terms of women that are positive for COVID or under suspicion after birth. But really with breastfeeding, now that we know that one milk sample tested positive for antibodies, I think that's like a no-brainer that women should be breastfeeding their babies, that our body's immune system is responding to COVID and is making antibodies. So women that want to breastfeed, we are suggesting if you're COVID positive that you are taking proper respiratory hygiene, and that pretty much means coughing, sneezing into your elbow. While breastfeeding, wearing a mask. This disease is airborne and it is droplet. So if you cough and you sneeze, you're producing droplets which can fall onto the baby. So they're recommending to keep a mask on while nursing, and obviously good hand washing before and after, and any common surfaces, just constantly disinfecting them. Let's see. Just want to make sure I'm not missing anything. So that's really it with the breastfeeding. Mostly what I'm going to talk about now is if a COVID mother comes into the hospital in labor and is a confirmed case, or is a PUI, which is person under investigation, what the CDC is recommending, and then who the World Health Organization is recommending. So pretty much the transmission after birth with an infectious person is obviously, like I said before, it's secretions from the respiratory tract. So if the mother is positive, there's obviously a huge risk that she can give it to her newborn, but really anybody, not just the newborn, anyone she comes in contact with. To reduce this risk, the CDC is recommending that there be temporary separation between mother and baby. They suggest the separation pretty much until the transmission of the virus can't happen anymore, which unfortunately is 14 days. The only promising thing is that if the baby is separated from the mother, they're going to treat the baby like a PUI, so a person under investigation, and they're going to isolate the baby, and anyone in contact with the baby is going to be wearing PPE, which is like the personal protective equipment, and that's gown, gloves, face mask, and eye protection. They are recommending this if partner or caretaker is healthy to remain with the baby. Otherwise, visitors should be restricted, besides obviously healthcare workers. The decision to discontinue temporary separation of the mother and baby is made on a case-by-case basis, and that's going to be with the clinicians, infection prevention team, and control specialists. Obviously, if we have a COVID positive mom and she's separated from her baby, we're going to be going by the severity of the disease, symptomology, and her lab, the lab results. There's ways to test, all of that. They're using the same protocols pretty much for anyone that is COVID positive. So whether you're, a new mom or not, they're still going to be taking all those measures, going by the severity and symptomology and, the duration before taking you off that isolation and quarantine. So they're saying that if co-location, also known as rooming in, of the newborn with his or her mother in the same hospital room occurs in accordance with the mother's wishes or unavoidable due to facility limitations, facilities should consider implementing measures to reduce exposure to the newborn. They suggest that there be physical barriers like a curtain between the mom and the newborn and to keep the baby 6 feet away from the ill mother. They're also suggesting to put the baby in an isolette. For anyone that doesn't know, the isolette is a lot of times you'll see what the NICU babies and premature babies are in. They're like those little boxes, and that's just because they're protected in there. They're saying if no other, now this is from the CDC, if no other healthy adult is present in the room to care for the newborn, a mother who has confirmed COVID or is PUI, so person under investigation, should put a face mask on and practice hand hygiene before each feeding or any close contact with her newborn. The face mask should remain in place while in contact with the newborn. Let's see. And these practices should continue pretty much for as long as they suspect her being infectious, which again, we know that COVID right now, from the time you come in contact with it, it's anywhere between 2 to 14 days, but they're pretty much following that 14-day rule. I can tell you with some of the things in the hospital, and I just asked what our hospital protocol was. Any mom that is positive COVID or suspected, when they come in labor, they're going to be put in a negative pressure room, and that pretty much contains the airborne contamination within the room. So it's just like the way the airflow is in the room. So that way when they open the door, the airborne particles can't get out and spread into the hallway and onto sterile equipment and to other people. Negative pressure rooms is a common practice in healthcare. They'll use it for anyone that has like tuberculosis and things like that. So hospitals are equipped to put up negative pressure rooms. So that's really it. The other thing with if mom is positive and baby comes from the WHO, and the WHO's guidelines are much shorter. They pretty much don't recommend separation of mom and baby. They actually encourage close contact and early exclusive breastfeeding to help baby thrive. To do that, you should be supported to breastfeed safely, which is what I've gone over. Respiratory hygiene, mask, good hand washing, keeping surfaces clean. And they actually encourage holding your newborn skin to skin, sharing a room with your baby, and obviously they end with washing your hands before and after touching the baby. So we know that it can be recommended, but it can't be mandated, and you do have the right to refuse that. So for any of you mamas, I'm happy to have got all that information for you. And that's it.
Thank you so much, Lisa.
No problem.
I know that you went over this. I just want to reiterate that, the CDC recommendation is a recommendation, not a mandate, and that as a parent, you are still able to make that decision to say, that you don't want to be separated, and that would be acceptable at all hospitals. Okay, so Felicia is going to go over birth plans, okay? Because if you are going to the hospital during this time and you are not able to have your doula and your partner with you, then it's going to be important for you to have a birth plan in place, and also early on, and have this to go over with your providers now. Mm-hmm. Because if it's something that you're asking that's outside of protocol during this time, then you want to know now, right? So I'm going to hand it over to Felicia before I just say everything she's going to say.
It's all right. You're the guru.
I'm going to mute myself.
So I'm not actually thinking on the birth plan itself, we might need a COVID-19 section, which mentions about separation of mom and baby, so that you know right away, like, hey, I never want my baby away from me, or I do want my baby away from me if I'm sick. Basically, your birth plan is something that you want to keep in place right away and talk with your providers, and you don't want there to be basically nothing up for discretion. You want to be able to tell your provider and where you're going that this is where I'm flexible on and this is what I'm not flexible on. So when you're thinking about your birth plan, you write about your background, like your details about your medical team, who you want at your birth, if they're still allowing someone at your birth, the hospital or your birthing center. So you can kind of always have that on you and then make a lot of copies of it. You want your preferences during labor, like labor and delivery positions, pain medication, labor induction. You also want preferences for giving birth, episiotomy versus tearing. There's so many of what kind of anesthesia, if you want an epidural in case you need a C-section, who to consult in an emergency. All this should be on your birth plan. Preferences for after the delivery, who's going to hold your baby first, who's going to cut the cord for your baby, medical procedures for baby, such as circumcision or vaccination, baby with you at all times, or do you want baby to go into a nursery? And I have a copy. This one's actually from Pampers. Pretty much any website like Baby Center, What to Expect, a lot of them have templates that you can have. So I have a lot of them saved if you guys want to shoot me a private message and I'll just email them over to you, or you really can go on Google and write birth plan template. But now's the time more than ever to have that with you at all times. When you walk into that hospital, you say, hey, this is my birth plan and I am not flexible on all this. This is what I want. And no one can really, you have to keep fighting for that and making sure they know what you want at all times. I don't know, Jen, anything else you want to add to that? I know it's kind of short.
No, that's perfect. I think that to reiterate the fact that, when you are having a hospital birth, you are receiving standard of care at all times.
Right.
And there might be some things that you want that are outside of standard of care. Mm-hmm. For instance, I always think about whether or not you want directed pushing or non-directed pushing.
Yeah. Or delayed cord clamping.
Yeah. So, delayed cord clamping, especially with the midwives, is common practice now.
Better. Good.
But like non-directed pushing is not still. And we know that when you don't have your pushing directed and you just follow your own urges, that there's less trauma to your perineum, which,
right.
Yay, everybody wants an intact perineum. So you want to be able to follow your own urges there. So that might be something that you really want to put on there. Mostly what's managed during your labor at a hospital is that second stage and third stage of labor, which is pushing and placenta. Yes. And I just want to put a side note in there that Felicia delivered her own baby at home. Like there was nobody there.
There was nobody there.
She just pushed that baby out.
And I pretty much had no tearing. It was like a little cosmetic cosmetic boo-boo.
Like keep your legs closed the next 2 weeks and you'll be fine.
Exactly. And that was the non-directed pushing because it was like not stopping that.
Yeah. It just comes out. So
my birth plan was pretty much abided by.
Yeah, definitely. So awesome. Thank you so much, Felicia.
No problem.
I'm going to hand it over to Christina Harris. She is going to talk about how you can advocate for yourself during a hospital birth and how to speak with your birth team. You ready, Christina?
Yes, let's do it.
All right, cool.
Okay, can y'all hear me? Everything's good? Hello?
Yes, we hear you.
Okay, all right, awesome. So unfortunately, given the circumstances of the times, it's kind of like you really have to prepare for the worst case scenario, but also hope for the best. And hopefully you will be able to have some kind of support, but if not, you're still able to advocate for yourself. So I think one of the most important things, first and foremost, is to educate yourself. And in educating yourself, you're empowering yourself. So when you know about the physiology of birth and you know what to expect throughout the process, it can ease some of those fears and some of the anxiety that you might have. So I definitely think education is definitely powerful. And then it's also talking with your provider, and that conversation about what's important to you. And for instance, going on off of what like Felicia said, having a birth plan and beginning to think and know what you want and desire, and be able to talk to your provider about that. The earlier the better. And also to note that it's never too late to change providers. If you're not satisfied with the care that you're getting, or with the way in which they receive what you're trying to speak with them about, look for someone who is going to be supportive, whatever the circumstances. So again, a birth plan is very important. And like Felicia said, like make plenty of copies. And I would also almost suggest pulling out things that are like non-negotiable. Like some things, you know, given certain circumstances, you know, you might have to negotiate on, but then there are certain things that, like, if you do not want separation, you make that clear, write it out bold and plaster it in the room somewhere. And also just ahead of time, maybe brainstorming scenarios of things that may come up and that may be important to you, and kind of how you would react or what you think about those things. Because I think that can kind of help you just kind of, once again, better understand what may occur during this time. And then at the hospital, just remaining calm and being kind and respectful might be much better received, but you also need to be firm and know, more important than anything, that you are in charge. You have power, that your voice matters, your choices and your desires matter. You have the ability to fire providers, or for instance, if you don't like the energy and the way in which a nurse is speaking to you, you have every right to say that you don't want Karen present anymore, that you prefer someone else. So you need to make sure that you're speaking up and owning your voice. You have the right to bodily autonomy. You have the right to say no. So whatever papers you sign at the beginning when you come in, that doesn't grant providers permission to do whatever they deem necessary, because you must grant informed consent. So you should have informed choices and informed consent. So that means you understand the options available to you and that you are consenting to them. This also goes on to, if there are decisions to be made, utilizing the e-brain, which is taught in the Birth and Beyond curriculum. And I believe Jen is going to distribute some information sheets. Is that correct, Jen? That will have like some of this information for you all. Okay, awesome. So this will have a much better, like, thorough, the sheet will explain in more detail what the e-brain is, but basically, if there's a decision that needs to be made during birth, it's questioning, is this an emergency? So asking that question, because if it's not, then you're able to say, okay, well, what are the benefits to this? And to seek how it will impact your labor and you as well as the baby. What are the risks, again, to impacting your labor, you, your baby? And then are there any alternatives that you could perhaps choose from? And then also just going with your intuition and knowing, like, that feeling in your gut, like, there's something to be said for that by far, because you know your body more than anyone else. So really going with that. And then also just asking for more time, because if it's not an emergency, then take a little time to kind of step back, think, and process. And then also another way to kind of advocate, but without speaking words perhaps, is the idea of your birth environment and the space. And I know Jen is going to speak on birth environment next, and just kind of how that can impact your birthing situation as well. And most importantly too, just seek out support. Seek out support now, seek out support during labor, whether that's like a virtual doula support, and also just education. There's a lot of options being offered for free virtually online for women. So educate yourself, empower yourself, and own your voice, and you are in charge. That's it.
Thank you so much. That was great. I will be posting, all the things that you'll hear on tonight's call, just so we can follow up with you guys and on the things that we feel like you'll need to have. So I'm going to talk about birth environment, and it's a little different than what I would probably talk about when I do my childbirth education course, because we are, quite frankly, living in a different world right now than we usually do. I think I mentioned I spoke to Christina Coaches this morning. She's the head of the Stony Brook Midwives, and one of the things that she had mentioned was to pack as light as possible when you're coming to the hospital. We do see some people come in with suitcases and suitcases for their labor. So she just mentioned just to keep everything kind of, to your essentials, which kind of, can you ask your dad? 3,000 questions a day. I'm asking for you to ask him one of those 3,000. Dad's sleeping. Go have a snack. Unbelievable. So yeah, you might not be able to bring everything that you wanted to, but if there are things that are important to you, then you stuff those in that bag and you bring those things. I guess what the question was that I asked her was, how sterile is the environment? Like, are we going to have to burn all our clothes when we leave the hospital? And her response was, coming to the hospital right now is safer than going to your grocery store, which I believe that to be true. They're screening everybody upon entry, and everything is so sanitized and so sterile that I do believe that it's very safe there, that you're not going to contract the illness just by going in to have your baby. So I just narrowed it down to a couple of things I think is so doable for your birth environment. One of them is birth affirmation flags, because so much when you're during labor and having a contraction, if you have something to focus on, like a focal point, going back to, Lamaze back in the day, we had this focal point to look at. Well, birth affirmation flags are a wonderful thing because they also are kind of like a mantra you can repeat in your head. So my suggestion is to call on those family members, your sisters or your doula that you had originally planned to be a part of your experience, and ask them to make up some flags for you and send them to you so that you can bring them to the hospital and just tack them up on the wall, or just have them next to you, next to your bed so you can look through them while you're laboring, just to have that closeness of you and your family in a time where closeness really isn't an option. So that's one of the biggest ideas I think would be super helpful. And also music, right? Music is something that's so doable. So make yourself a playlist. Some of the things that we talk about in our regular education course is that music is effective at blocking out unwanted noise, right, in a hospital. So very effective at that, but it also makes the time pass seemingly quicker, and it helps to regulate your breathing. It lowers your blood pressure. It increases your comfort level. There's so much involved when you listen to music. But there's other things you can listen to as well, like guided affirmations, guided relaxation, hypnobirthing, hypnobaby soundtracks, prayer. There's other things on top of music. Hi. I love seeing all the babies. So that's my environment for right now. Obviously, there's other things that you could do. You could bring in some fairy lights. You can bring in some battery operated candles. It really does set the environment nicely. But if you want to keep it simple, those are like my top two things: visual points, something for you to stare at, and music. Okay. And so that's, oh yeah, okay. I'm going to send this to you too. This is like our idea of all different types of affirmations. And you can pick out your favorite ones and send them to your family members and ask them to print, draw up a flag, grab some Crayolas, have your nieces and nephews put some stuff up for you. But they're beautiful things. Like, I trust my body and my instincts. Me and my baby are safe. I am strong. Send my breath to my baby. I don't have to worry. My body was meant for this. So really beautiful, beautiful things. Is Susanna on the call? I didn't see her name. Hold on a second. There she is. All right, let me unmute you. Hi. Hi. Great. Oh, look at you. You look so nice and comfy.
Oh, thanks. Actually, I'm comfortable because I'm sitting on a birth ball.
Nice.
So yeah, so I'm going to talk about some positions. These are things that you can do whether you are by yourself or with someone. And maybe that person is hanging out and talking to you, and you can do these on your own. So whether you're by yourself or you're not, these are some really awesome and easy things to do. So I'm crouching because the phone is at a weird angle and I'm very tall. So anyway, so a birth ball, like we all talk about this as doulas, we love the birth ball. We encourage moms to get on it now, like during pregnancy, work on your flexibility and your strength and things like that. But during labor, it's also really great. If you don't have one of these, or the hospital where you're going doesn't have one, like Stony Brook keeps them in stock, but let's say you're going somewhere else and they don't have them, it's not a big deal. Like you could sit on a chair or like a stool, or maybe the corner of the bed so you can have your knees nice and wide. Same type of thing, put the bed nice and low, and then it's like a supported squat. So anyway, let's say you do have a ball, like a classic movement is keeping your knees nice and wide and working on rotations, clockwise, counterclockwise, doing figure eights. Another thing you can do if your upper body starts to get kind of tired, but you still want to sit on the ball, you can face the bed and lean on the bed, so you can rest your upper body. If you want to stand up, but still use gravity to your advantage, you can put the ball on the bed and lean on it, but keep your feet nice and wide and give a nice good sway. Maybe you're swaying to that music that Jenn was just talking about. You can also be on your hands and knees on the bed, but leaning on the ball. So this is another option. In some hospitals, they also have what's called peanut balls. I like have little visuals that I printed out. So some hospitals have peanut balls, and here's some like great options. When you're sitting in the bed, putting it under one leg or the other, laying on your side, keeping your knees apart, stuff like that. If the hospital does not have these, what you can do is roll up a blanket or put a pillow there or something like that. Any of those are great. So let's say you're having some back pain. All moms have some form of back pain throughout labor. Ways that you can help with yourself. We often talk about counter pressure. So you can do this for yourself by making a fist, putting it on your lower back and leaning against a wall. Or maybe you have a tennis ball and you can lean against the wall, same thing. So we're putting pressure right in the lower back, like in the sacrum area. And that can really help. We can also use the bed. So like using what's around you is important. It's easy. You don't have to bring it with you. So the bed goes up and down to different heights. One thing that's great for that is lunging. Doulas, we always love lunging too. So standing to the side and putting up one leg or the other. You can be on your foot and kind of lunge to the side. You can be on your knee and kind of lunge to the side, whatever feels comfortable. You do your right leg, you do your left leg, nice and easy. Again, being on your hands and knees. I have more printed out visuals for this. Classic move, you can do some cat-cows. I don't recommend being on the floor, but definitely doing this on the bed is completely fine. The bed also goes into a lot of different positions. So something that's nice and easy is putting up the back of the bed all the way up. So you're sitting straight up. We like to use gravity to our advantage. So this is one way to do it while you're resting. This is kind of like a big throne, like a big chair. Most of the nurses at hospitals know how to do this, so they can help you with this. Same thing, if the back of the bed is up, you can face the other way and lean on it. Again, using gravity to your advantage. Being on your knees, leaning up forward on the bed. Nice and easy, something that's there. Lots of hospitals have squatting bars. I should be a teacher. My mom was, so like she was like, you need visuals. Anyway, so
Lots of hospitals have squatting bars, and not all the time do they bring them out. But if they do, and you can always ask for one, it hooks onto the end of the bed. Again, the nurse can help you with this. And it's a way to do a supported squat. Squatting is awesome in birth. We love to see moms doing it. It opens the pelvis by like 28% or something like that. So something really incredible, again, really easy, and you don't have to bring it with you. Also using, a lot of hospitals have showers. That's a great, like water is a great pain reliever. Standing in there, aiming the water at your lower back. You could bring your birth ball in there and sit on it. They might even have a chair you can sit on and just sit in there with the water running over you. That can be so nice. And lastly, I will say sitting on the toilet. As funny as sometimes moms think that is, laboring on the toilet, actually, I even have a visual for that, I'm not gonna lie. So laboring on the toilet is awesome. It's a supported squat. And if you think about when you're normally sitting on the toilet, you are completely relaxed. And that's what we need you to be during labor. Like relax, let it go. The more you go to the bathroom, the more space you make for baby. So it's all positive things. Stay on there through a few contractions. Stay in there for 20 minutes if you want. Staying hydrated and getting up and walking to the bathroom and going to the bathroom alone is great because you're up, you're moving, you're walking. Dancing to the music that, you know, Jen suggested, like, awesome, like get up and move. That's fun, sing along, like have a dance party. And I will say, I wanted to talk about affirmations too, like Jen just did. So whether you choose to make yourself a banner, or I love the idea of having family and friends making little things for you and sending it to you so everybody's included, that's an incredible idea. Whether you have a banner or not, maybe you just print out some stuff and you place it around the room. So as you move around, you see something different. It can just be so great. And that's something you can start using now. You know, birth is obviously hugely physical, which is all like the options I just went over. It's very emotional, but it's hugely mental. And so starting now with those affirmations and telling yourself, I can do this, my body can do this, you know, billions of women have done this before me, and now it's my turn. Aren't I lucky? Can be really great. And like Christine was saying, we want you to feel empowered. You know, we talk about healthy baby, healthy mom, and yeah, that's the ultimate goal. But really, we want you to feel empowered with every decision that you've made, every move that you've made, and in general in the outcome. So best of luck to all you mamas, lots of birthing love and things like that. So thanks for putting this together, Jen.
Thank you so much. Thanks. That was wonderful. Okay, great. So I am going to, I'll run you down the rest of today's call so that you guys know what to expect. I'm going to go through some quick coping techniques that you can do. Heather is going to walk us through some breathing techniques. Laura is going to talk about the importance of childbirth education and doula support, even in a time where you can't have a physical doula in the room, but virtual doula support and what that can do for you. And she's going to announce a little bit of something that's been like rumbling around in my belly all day today, making me so excited. She's going to kind of give us a small preview on what that's going to look like. And we're working feverishly to get this rolled out by as soon as possible. I'm not going to put any dates out there because Laura will kill me. And then I'm going to end the call with the Q&As that most of you sent some questions. I'm going to try to answer all of them as best as I can and let you know the ones I can't answer, because quite frankly, I don't have the answers to it, but I'll answer as many as I can, okay? So I'm going to go into coping techniques, and my favorite coping technique, I think sounds so silly, but I will tell you, it is not. Packing a wide tooth comb in your bag, because during a contraction, you can take the comb and crap, I wanted to have one with me so I could show you, but I don't, of course. I'll show you my phone. So oh, look, you got something. You take a comb and you put the teeth of the comb right here on your palm and you squeeze it. So a couple of things with this technique is that it serves as a distraction. right? So however you can distract yourself while during a contraction is a wonderful thing. This is one of my favorite distracting techniques because it also hits some pressure points here on your palm that kind of relieves pain for you. So there are lots of different pressure points for you during labor that you can press, like right between your pointer finger and your thumb. If you press that pressure point there, you know, Susanna talked about the point on your back. That's also a big pressure point. Right above your ankle bone on the inside of your leg, if you put 4 fingers there and up above that ankle bone, there's a pressure point right there. You can almost feel it. It's a little like maybe even a dip, or it might be sensitive there. That's a pressure point. So all of these things you can do on your own, but I just love this wide comb technique. I always pack one in my doula bag, and I will tell you almost every birth I go to, when mom gets into a contraction, she's like, "Where's my comb?" And it's like something she needs to have. So pack a comb. Bendy straws. So the hospitals don't supply straws anymore because environment, right? But I think that especially if you don't have a partner there that's going to be feeding you sips of water between contractions, having a long bendy straw, you can order them off of Amazon, so you could just kind of sip it between contractions. Super important for you to stay hydrated, especially if you're not hooked up to an IV. So super long bendy straws would be a cool thing to have. Hot and cold packs are available in your room in every hospital. I can tell you in Stony Brook, they're in the second drawer on the right side of your bed. So you just grab these, you crack them, and you use them. I will tell you the hot pack is really good. I'm going to try to show you my pelvis area. Right here on your pelvis, you put the hot pack right there, and it feels oh so good. Even if you're hot, that heat there on your pelvic bone really feels nice. It also can feel nice on your lower back. So use your hot packs for that. Cold packs would be really, really good for you, wrapped in kind of like, they have those like paper towels that are a little bit more heftier. On your tea time, wait for tea time. Okay, I'm almost done. On your neck, on your chest, on your forehead, so you can use the cold packs for that. That's huge. Any kind of hydrotherapy, that is a big deal. Ice chips, that's also a really nice distraction technique. So just having a cup of ice chips in your room and taking a couple before you have a contraction. You have to concentrate on that ice, right? Like you have to crunch them, suck on them. So you're thinking about those ice chips in your mouth more than you're thinking about the contraction that you're handling. So that's another good distraction technique. Any type of rebozo, baby wet wrap, or if you don't have either, you can use a sheet in the hospital. You can do abdominal lifting on your own, which is a nice coping technique. I think Christina, you had said that that's how you coped through your whole labor, was every time you had a contraction, you lifted your belly up. So I don't have a belly because I'm on Weight Watchers right now, but you kind of interlock your fingers underneath your belly and you kind of just gently pull it up and then gently let it go down. If you want to use your rebozo or your sheet, you can wrap that around the bottom of your belly, bring the rails up over your shoulder, and pull and lift your belly that way also. I'm going to send you pictures of this so that you can have it for reference. But rebozo is really good for a lot of things. So if you have one of those, pack that in your bag. You can have that. I think Susanna talked about this also, but the affirmations, just repetition mantras. And sometimes this is not something you're going to premeditate, but it might be something that just comes to you when you're in labor. When I was having my 4th baby, I just kept saying over and over again, my baby is okay. My baby is okay. My baby is okay. It just came to me, and that's what I was saying. But things like, I am okay. My baby is okay. I am safe and secure. I am safe and secure. My body is strong. My body knows how to birth my baby. Women all over the world are birthing with me right now. I'm not alone. Those are just wonderful birth affirmations, mantras that you can repeat over and over in your head. Just a wonderful coping technique. And any kind of vocalizing, but I don't want to say any kind, because I don't want you to shriek. I don't want you to scream, because that tells me that you're not coping well. So when you're vocalizing, try to keep it to low moans, thinking, remember this, remember Jenn Barry saying, mama bear, right? Low moaning, groaning type, mama bear, ohs, ahs, anything that opens your mouth. I know I look silly, right? My daughter's laughing at me. She's making fun of me. Any type of groaning and moaning, those mama bear type things, that's what we want to hear. Something that connects like your vocals to your vagina, open that all up. Ohs, ohs, ohs. So those are coping techniques, along with breathing, right? We want you to breathe, but Heather is going to go through with you some really nice breathing techniques for you during labor. So I'm going to find Heather. There she is. You ready? All right, you're on.
Thank you. Hi, everyone. Thanks, Jen. This is awesome. So just a few minutes on some different breathing techniques that would be really good for birthing and dealing with what we're all dealing with. Some basic things to consider is that in a time that we are in so much uncertainty and where our basic sense of safety and security is being shaken up big time, in terms of a yoga practice or a mindfulness practice, it's nice to be able to connect with our energy system. And our root chakra has everything to do with our sense of safety and security. And being that, again, that's something that is very unstable at the moment for most of us. It's doing any types of grounding practices is going to be something that's really helpful. One of those things is bringing in any type of earth environment, or earth element, excuse me. So anything from plants or water is particularly a wonderful one, especially since the second chakra, which is the home of our baby, or where our womb is, the element of the second chakra is water. And I know that Susanna had mentioned something about using the water element and some of the preparations that we do. So using what's called an ocean breath is a beautiful tool to be able to utilize in our everyday life, in birthing and in parenting. And it's a wonderful way also to breathe that baby down, because the ocean breath utilizes our breath moves into the lower parts of our abdomen, into the womb, in toward our baby, into even our pelvic floor. And so it's just a perfect marriage to be able to utilize this breath for birthing. So I thought that I could talk you all through a little practice of that for a moment, if that's okay with everyone. And you may not be able to keep your eyes closed, but if you are, then I invite you to do that. And if you're able to even put both feet onto the floor, so that again, really feeling your feet on the ground, on the earth, or your seat in wherever you're sitting, whatever you're sitting upon. And then just begin to connect with your breath and all the elements that you notice, all of your senses, everything you hear around you, everything that you can feel, the air, the temperature of your skin, anything that you may be seeing in your mind's eye. And then take your hands and just place one hand on the center of your belly and one hand on the bottom part of your belly or your baby. And then take a big deep breath in through your nose, filling your whole belly up with breath and allowing that breath to move down into the deepest part of you, into your pelvic floor. And then as you exhale, hug your belly and your baby back toward your spine, just letting everything go. Then taking a deep breath in again, hugging gently the back of your throat, sitting up nice and tall, reaching the crown of your head toward the sky. And then on your exhale, still hugging the back of the throat to create a sound just like the ocean waves. So inhaling nice and big and deep, filling the belly and the heart with breath. And exhale, hugging the back of the throat, just as if you were fogging up a mirror or a window. Inhale and exhale. Inhale, breathing that baby down, releasing the breath into the deepest parts of you. And exhale, hugging your belly back towards your spine. Take one more breath here. And this time just open out the mouth and exhale the breath. So inhaling through the nose, sitting up nice and tall, and opening the mouth and just exhaling the breath out as if, again, you were fogging up a mirror or a window. Inhaling through the nose, nice and slow. And exhaling through the mouth even slower. Doing this 2 more times, inhaling. This is a great breath for when things get heated, moving through transition. The surges of the body makes you feel much warmer or too fiery and you're trying to let things go. And so exhaling that breath all the way out, even longer than your inhale. And then take another deep breath in through the nose. And exhale, let it go through the mouth. And then relaxing everything down. Letting the breath go back to its natural state. And then slowly opening the eyes if they're not already. And that is a type of basic breath that one can use, and to even take it further, doing a synchronized breathing with a partner if we are lucky enough to be able to have someone there with us. But even if they're not there in person, and I'm not sure what the policies will be, I'm not sure if anyone spoke on that, but will there be able to be someone supporting through the phone or through a FaceTime or through a video or something like that? I know there's a lot of liability and policy around that. But even if someone is on the phone with you, you can do a synchronized breathing where each person is inhaling at the same time and exhaling at the same time. Being able to have eye contact is something that is very grounding, and that connectivity allows us to not feel so alone, especially if there isn't anyone there. And that's something, again, we can even do on the phone. So, and then remembering just that when you need to feel more cooled down, doing any inhales through the nose and exhales out the mouth, or even inhales through a curled tongue to bring in cool air, and exhaling through the nose can also be really helpful. So I hope you all continue to go with the flow and breathe our way through all of this. And I really appreciate all the energy and work that all of you are doing, and you're such inspiring people. Thank you so much.
Thanks, Heather. And Heather, you running virtual prenatal classes still through Sea Change?
Yes, we are. We will be offering a prenatal yoga class on Saturday morning at 10 a.m. on Facebook. So you can tune into that, and that is also recorded, so you can utilize it whenever you would like to. We're offering virtual hypnosis and also phone support, and we'll probably do a baby and me yoga class at some point next week or in the next week or so.
Thank you so
thanks
much.
for mentioning that. Yeah.
Thanks. Okay, so I think Laura might be ready because we're running a little ahead of time to go through. Is this you, Laura, the nesting place? I think it is. Hold on a second.
Yeah, I'm here.
Oh,
Sorry.
great.
Just
Okay,
got number
awesome.
3 to bed.
Okay, awesome. All right, go ahead. You're on.
Okay, cool. So yeah, I just wanted to provide a little update on a program that we're working on. So a couple of the local doula organizations, doula training organizations, Long Island Doula Association, Birth and Beyond Resources, Traditional Doula and Midwifery Arts, as well as East End Birth Network, are joining forces to create a new program to support moms and families in the community. And we're really excited about it. So we're going to be rolling out a couple of different initiatives. The first one that we're going to be doing is a access line that moms will be able to call into 24 hours a day to reach a doula on call to support them through labor if they are alone through the process. So we're going to probably start rolling that out next week and start with the hospitals that have restricted partner support. To get started, because we feel that those moms, are really going to be in need, seeing as how they're going to be alone through the labor and delivery process. The second part of the program is we're going to be offering almost like a care coordination service, and we're calling it a healthcare or a perinatal guide to help moms navigate the current landscape of being pregnant and going through delivery and postpartum period given this pandemic. So the 4 organizations are partnering together to be able to offer this service to moms who are pregnant and postpartum, and really just give them a designated match so that they can have somebody to consistently rely on for questions, concerns, talking through options and choices in the community, and then also somebody who can provide them additional resources and referrals as needed. So it's not to replace doula services, but we have a number of members in all organizations who are eager to help any way they can. And there's just a wealth of information and knowledge that we want to be able to share with the community. So we just wanted to put it into a more organized structure because, both Long Island Doula Association and Birth and Beyond Resources have been fielding a number of various questions from the community. And we just want to be able to match people up with somebody who can really guide them through this time and ensure that they're getting the proper supports and information that they may need. So we're really excited about this. The program, we've sort of named the coalition. So the name, now I'm forgetting it. We just named it today. So we're calling it United Perinatal Support Coalition.
You got it.
And it's a marriage of the 4 organizations that I mentioned, just coming together and really rallying to provide this necessary support to moms in our community.
Thanks so much, Laura. So we're so excited. I wanted to kind of get that out tonight to all of you because I know how much uncertainty there is, but I wanted you to rest tonight knowing that we are all here for you. And although at some points in this journey that you're on, it might seem like you're alone, but you are not alone. We are all sending all of our thoughts and well wishes and blessings and prayers to you during your time. And we're putting together these services for you, and if it's needed, we could do it at low cost or free to those that are going through financial struggles. So all of that's being worked out so quickly over here. And we're hoping to get that launched very quickly. So thanks so much, Laura.
Thank you for having me.
Okay, so now I am going to go through some of the Q&A that I got from everyone who signed up for tonight's meeting, workshop. So one of the questions was, is the food safe at the hospital, or should I pack my own? And the answer to that is yes, the food is just as safe as it would be coming from, you know, a local restaurant in today's world, right? But definitely probably safer because of all of the protocols that they have in effect right now for the hospital and all the sterilization and all of the protocols that they have. It's super safe. However, they said that if you feel more comfortable bringing your own food, you can absolutely do so as well. It's really up to you. One of the questions was, will I be considered for an induction if I want one? And the answer to that, it really, I guess, depends on your situation. I think the person that had asked this question was a VBAC. And most providers won't induce a VBAC or a TOLAC, which is a trial of labor after cesarean. But they are discouraging any elective inductions at this time because they are trying to lessen your stay at the hospital. They want you in and out as quickly as possible to keep you safe. And we know that if you're having an elective induction and your cervix really isn't ripe, that you could be there for days during the induction process. So they are discouraging from that. Now, if you're 42 weeks and you want to be induced, they said that they will, you know, take that into consideration, but overall discouraging. They wanted you to know that labor and delivery is fully staffed. They have all the supplies they need. I know that there's a lot of information out there that we don't have masks, we don't have this, people are in trash bags. But they are fully staffed, especially at Stony Brook Hospital. Everyone in there is wearing masks at all times. And when you are in your second stage of labor, which is your pushing stage, they will be in full PPE, which just basically means full outfit, goggles, and an N95 mask when you are pushing. However, that could change to be full PPE all the time, but this is what it is right now. And I should also say any of this really can change. And we are going to keep you updated on a daily basis. Also, Chris said that the Stony Brook midwives are organizing a live video that they can kind of walk you through the L&D wing to kind of show you what to expect. She says it's really not crazy there. It's very organized and very safe. Like I said before, safer than your local grocery store. So she wanted to put your minds at ease to let you know that that's how it is at Stony Brook and in most of your hospitals that are here locally. If you are wishing to transfer care. So I know that we have some people in this workshop tonight that are delivering at hospitals that are either no partner or are inching towards no partner, and that may change your decision. I know most all of us are wanting to have a hospital birth and not a home birth, but if you're thinking, man, I wish that I could switch to care at Stony Brook instead, or a different hospital, you can transfer care really at any point in your pregnancy. So don't be afraid that if you're 37 weeks that it's too late. You can always transfer care. They are also prepared that they do know that there will be people showing up at Stony Brook Hospital that aren't under the care of any of the providers at Stony Brook, and they are prepared to handle that. But they said that that's not really the best scenario because they don't know that they'll have all of your paperwork and all of that other good stuff that they need. I think Lisa Garcia, I don't know if she mentioned it tonight, but she said if you are one of those people that's just planning to walk into Stony Brook without being a prior patient, that you should have all of your records printed with you upon entering the hospital. However, if that's what you're thinking, just transfer care now. If you're thinking about transferring to, say, the midwives, call them up, 631-444-4686 and tell them you want to transfer care. It's a super simple thing to do. And I'm happy to walk you through it if you need more help on that. Stony Brook has no plans on taking away the partner at all. She says leadership supports it. They have no plans. She doesn't see it going away. So please rest with that on your pillow to know that that's probably not going to be taken away at Stony Brook. But like I said, we will update you guys on a daily basis on our page, and we'll share it to the group also. You do not need to disclose that you're living with or have been in contact with someone who is in contact with people who are COVID positive. So say your husband works at the hospital and he's in contact with COVID patients. You don't need to disclose that, because basically it's not going to change anything. Guess what? We've all been in contact with somebody. Just a reality. I mean, there are more cases in the US than any other nation. Someone knows somebody who knows somebody who knows somebody who's got COVID. It's not going to change the situation at the hospital. Everyone is screened when they enter the hospital. Everyone's temperature is taken. Everyone's given a mask. And there is a series of questions and then an algorithm set up based on answers. And patients are deployed to either triage, the ER, or LMD. So that's what you can expect when you go to Stony Brook. So as I said before, partners are still allowed at Stony Brook. However, they will be taking their temperature every 12 hours during your labor. And if they show a fever, they will be asked to leave. So that is something that you should just kind of take in consideration, and why we ran most of this workshop with the assumption that you wouldn't have your partner with you, because that's a reality. Like if your partner spikes a fever during your labor, he will or she will be asked to leave. Currently, they're discharging patients with vaginal deliveries at the 24-25 hour mark. And that's really just because of the PKU testing that needs to be done at the 24-hour mark. They are trying to source that out so that you can leave ASAP after your delivery. But that's what it is right now, 24-25 hours, a little longer if you've had a cesarean, probably 2 nights if you've had a cesarean. So I'm not going to go through this because I think Lisa really went through this already, but the CDC recommendation, right? That if you choose not to be separated and you're COVID positive, that there will be an isolate put in your room, and they would also be asking you to wear gloves and a mask. So that's kind of where that comes down to. And Lisa might have said this also, but if you are pregnant and you have COVID and you go to the hospital and you're not in labor, say you're 32, 33 weeks, they're not going to be sending you to L&D. You will be sent elsewhere. If you are in labor and you're COVID positive, you will still go to L&D and be put in a negative pressure room. Yes, she did talk about that, right? And there's special staff for that scenario. To date, she did say at Stony Brook that they haven't had any pregnant COVIDs, not to just call them COVIDs, but pregnant persons that have tested positive for COVID, but just people under investigation that they were symptomatic, but they were all tested as negative. And that's pretty much it. The one last thing that I think I mentioned earlier was to bring in as little as possible to the hospital. So a small bag with your essentials. But when you leave the hospital, if you feel uncomfortable with, something being left like on you because of the nature of this virus, leave your hospital bag in your garage for a day before you bring it inside when you get home, right? The virus doesn't live on soft surfaces for very long. It really loves hard surfaces, cardboard, countertops, things like that, but it really doesn't live on clothes for too long. So just kind of, if you took a bag in with your clothes and your pillows, cases or whatever, just leave it outside for 24 hours or in your truck for 24 hours before bringing it inside, and then obviously wash everything. So those were all the questions that I could answer. There was a lot of questions about what if my partner's not there, and I really can't answer a lot of those. Your provider is going to need to answer those questions if you are birthing in a hospital that is not allowing your partner. So that's really going to have to be what it comes down to. Is there anything else that I can answer while we're here? It's 8:15 and we're done with the workshop. Or anything else anybody else wants to talk about?
I have a question.
Go ahead, Kay.
Hi, Katie Flash here. This may have been answered already, and I'm sorry if it was. I had to step away and get my son into bed for a minute ago. But I'm going for a VBAC, which in itself is a mountain to climb. And now potentially having to do this alone is even scarier. Do you have any recommendations for me, or what I could possibly do to make this successful?
So Katie, are you birthing at Stony Brook? I can't remember.
No, I'm going to Huntington, and I was with Dr. Lee, and I just switched to Huntington Midwives 2 days ago, and I'm seeing them.
Oh, that's right. I saw that.
Yeah.
Okay, and this is just a VBAC after one cesarean?
Yeah.
Okay, perfect.
And after a very traumatic one at that, so that's another thing that I have to contend with.
Okay. Do you have a doula virtually?
I do not.
Okay. Are you open to that?
I would be, yeah.
Okay. So I think that's a great option. Again, Huntington's still too, you can still bring your partner with you to Huntington, but even with your partner, it's super supportive to have somebody else there that can give you some educational support throughout your labor, to let you know what's normal, what's not. I am going to share with you some of the things here that a virtual doula can do via video chat or text or phone. We can help with decision making and options. We can encourage you to get information regarding benefits, risks, and alternatives. That's the e-brain that Christina was talking about. Proposed procedures or interventions. We can help you utilize your birth plan. We'll have a copy of it to talk about your preferences. We can share evidence-based information with you while you're in labor. And emotionally, we can verbally encourage you and provide your feedback, give you positive reminders about your progress, act as a safe place to discuss fears and concerns and reframe them if they're needed. We can encourage your birth partner along the way, also making physical support like recommendations. Kay, have you ever taken any kind of VBAC workshop?
I did. I actually took it with Lisa going back a few weeks ago.
Oh, great. Wonderful. Okay. So that's wonderful. I think that we can definitely hook you up with, like Laura was talking about, the program that we have where we can connect you with a care coordinator that can help you through this whole process, but hooking you up with a virtual doula that has VBAC experience, I think would be super beneficial.
Thank you. Appreciate that.
You're welcome. We didn't talk about that, so you didn't miss anything.
Okay.
And then somebody said, more information about the Doula Coalition. We are gonna officially probably launch that early next week, depending on how much work we get done this weekend. And we'll definitely broadcast that out to the world because we're very excited to come together and do this for the community. What other questions can I answer? Or you have a whole panel of professionals here that can help. Yes, someone said Stony Brook taking away the volunteer doulas at this time, and that is correct. That program has just been suspended because even though they might have worked for Stony Brook Hospital, could have been like that other support, they are just lessening the amount of extra people in L&D. They are fully staffed, right? So there's your nurses and your providers are there, but the doula program has been suspended. But, you know, that also opens us up for the virtual doula program where we can help you with things like that too. There's a free virtual prenatal support group Tuesdays at 7 p.m. with Marissa. I think she posted something today on the Birth and Beyond resources group. So please check that out. Marissa's amazing. Are there any supports available for the fathers who are not going to be able to attend the birth? Brandy, an excellent bring up. Who posted that, Laura? I don't know if that was in the community support group or if that was in the other thing that we're just doing. I think that came from East End. There is a podcast, right? You posted that about the dads?
Oh yeah, there's the Jay Gordon link.
Yes. Yeah, so we can share that too after the phone call. I have all your email addresses, so we can share that information. I think that already took place though. I don't know if it was recorded, that you guys can look in on it.
We can check and ask for it if not.
We'll pass it through. So Dr. Jay Gordon had done something for dads that, I can't find it right now, so I'm not going to hold you guys, but we'll pass it on to you as soon as I can find it so that you guys can see. Here it is. Support call for dads banned from hospital birth because of COVID. It was today at 12 p.m. So it's Dr. Jay Warren. So I'll share that with you. So, because maybe it was recorded and you guys can go back and look for it. So good question. Lisa also says that there's a new parent support group on Saturday. All of these are obviously online. And then Laura shared that Dr. Jay Warren link. Okay, so you guys have that there. All right, everyone. Thank you so much for coming on and joining us tonight. I hope that we were able to put some things at ease for you. I know it's a very difficult time, and I'm sending you all of my love and blessings, and just know you're virtually not alone. That's going to be my new tagline. We're here for you, okay? Have a good night. Thanks, everyone. Your foot.